Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, along with my wonderful wife, Janet, and we are streaming live from Sioux Falls, South Dakota. Beautiful weather here this time of year. I love it here. South Dakota is awesome. Janet is actually from the Dakotas. She's from North Dakota. I would love to move back here, but because she's from here and didn't like the winters here, we're not moving back here.
It's a hard no.
But South Dakota, I tell her, is a lot better weather than North Dakota. So today we're going to have Nicole Smith on our podcast. She is an ARNP specializing in women's hormone health. And as you know, Janet and I are two pharmacists that specialize in hormones. So we're excited to talk about that. As we wait for her to get logged in, Janet, what would you like to say specifically about women's hormones?
Oh, so we could be here all day talking about this, but we really have a passion for giving women some tools to help them to navigate their healthcare. One of the things that I share with women very commonly is that medications were studied and looked at and all under men. Women are usually not studied with medications. And even though we live longer than our men, we don't get the same care. We might have longevity, but maybe that quality is not as good as men. So I think we need to up the ante. So that's my starting point.
And Nicole's going to help us educate us on that. So Nicole, welcome to our show.
Hello, thank you.
So tell us a little bit about yourself first before we get into women's hormones.
Sure. I am Dr. Nicole Smith. I am a nurse practitioner here in Washington State. I've been practicing medicine for over 12 years now, and I started out as a hospitalist. So I've been working more in the Western medicine realm for the past decade, and just recently transitioned into my own practice where I'm specializing in women's hormone health, especially perimenopause, menopause, and then also PCOS, endometriosis, and things like that. And I've been doing that for the past 3 years. So here I am.
Well, welcome to our show.
Thank you.
And thank you for what you do, Nicole. It's, as you know, especially now, women's health and hormones is really hot in the media now. For 2 decades now, since the WHI study in 2002, we've vilified hormones for women, and basically over a generation of women have been, denied hormones, and it has really, really messed with their health.
Mm-hmm. Absolutely. Yeah. And it's very tragic is that the misrepresentation of the data and the sensationalized headlines that came out and scared a lot of providers, scared a lot of patients. I still see residual effects of that. I have patients who come to me who say, my doctor will not touch those. They will not prescribe it, or I've been on it. My provider told me they won't continue it, which is just, it's horrible because these women need these hormones to function and feel good, but also it's preventative care. So needs to be addressed.
Exactly. I mean, Jan and I talk about it all the time. Think about some of the drugs that we prescribe that are due to hormone deficiencies. Janet, talk about the bone density one. That one is a really hot topic for you.
Oh, well, Shawn and I have been practicing for almost 30-some years, right? So we've journeyed with patients in our own community for a long time. And I have seen women who otherwise, outwardly appearing very healthy, active, moving, but, they were denied hormones, right? And when they started having osteopenia or osteoporosis, they put them on like Fosamax or Prolia. And just recently in the last year, I had a lady who just fell out of bed, which isn't that far. Your bed to the floor is usually not that far. And her spine has bones that are crumbling. How do you fix that? You can't. And to me, to see women who were thriving have their life and their quality of life taken from them, from our traditional medicine and standard of care, where I know if she would have had the hormonal replacement, she would not be in this predicament. And it's painful to see that in people, as well as to see that they are suffering, and she's going to, because you can't fix that.
Mm-hmm. Absolutely. The past 5 years, the last 5 years of my career as a hospitalist, I was working in orthopedics. And when COVID hit, I had transitioned from working with primarily just total joint arthroplasty to fractures because we weren't doing elective surgeries there for a little while. And I really dove deep into that world and osteoporosis and everything. And it was shocking to me. And that is what the guidelines say to do. Fosamax is one of our first line treatments for fracture and even hip fracture, like coming out of the hospital. But also, there was a discussion, even among the guidelines, about using like checking hormones and using hormone replacement, but it's just not something that was commonly done. Instead, it was pushing, those other types of medications. And it's true, by that time, oftentimes it's too late. The mortality rate after a hip fracture is somewhere of 30% or more. It's even higher for men. It's upwards of 60% in the first year. And so to be able to get ahead of it, and that's part of what I'm trying to do with my practice, when I was taking care of these elderly patients with these fractures, it's like, there's got to be a better way to do this. So if we can head it off in their 40s or even earlier, then perhaps we can get that treatment started and not even go down this road, because it's still like one of the top killers of women is having a hip fracture and then ending up not surviving that.
And even if they do survive, you said the mortality is like 30% within the first year. Even if they do survive, the morbidity is horrible. I mean, what a horrible way to live. I mean, you can expand on this. You know more about this than I do, but I'm going to guess when a woman's in her 60s and has a hip fracture, I'm going to guess that her mobility is decreased for the rest of her life. Is that true?
Very, very often, yes. It is usually the end of their independence, and they end up needing to go into assisted living or even into a nursing home. And that is also what shortens their lifespan and their quality of life.
Right, right. Well, I think what's interesting too about back on the osteoporosis drugs is the biphosphonates like Fosamax or Forteo or Prolia, basically the three classes of drugs for osteoporosis. It's kind of I don't know how to explain it, but it's really silly that they're all indicated for postmenopausal women. Okay, what do postmenopausal women lack? They lack hormones. So why don't we fix the problem instead of giving them a synthetic drug?
Yes. Yeah, that was exactly my thought too. The more that I was diving into that research and those guidelines, I was like, wait, this doesn't really make sense. Why aren't we using that as a first line treatment? And that's just something that, again, it's that lag between the newest evidence and what is evidence based and then actual practice. Unfortunately, it's, what do they say, up 5 to 15 years. So
yeah, exactly. So on the topic of hormones and for bone density, but just hormones in general, and specifically women, one of the things that we miss with women a lot is testosterone. Can you talk about how important testosterone is for women?
yes, absolutely. So it's one of those that really gets shoved to the side because we don't know that, oh, by the way, we have more testosterone in our bodies than we do estrogen. We just don't have as much as men do. So we don't
Right?
have those same male characteristics, but it's just as important for us, for bone density, for libido, for brain health. And when we start to go down that road of having less testosterone, then you can give a woman estrogen, you can give her progesterone, you can even try DHEA, and we have done that, and then it's just not working. So I have those patients who we've and that's what the guidelines say to do. You have to try all the other stuff first before you can use testosterone because it's not FDA approved and insurance won't cover it. But I have seen dramatic change in women when we add testosterone to their regimen, and all of a sudden, now everything falls into place. All of the pieces of the puzzle fall into place, and they're finally feeling better when we just couldn't get them there any other way.
Janet, you got some comments?
I do, because I mean, to me, the big question mark goes out in my brain. Cardiovascular disease is still the #1 killer in the United States. And we know as we age, especially when we get into perimenopause and into menopause, that we do not have the same muscle mass as we did in our youth. And we need to really hold on to that to stay healthy and have longevity. So to me, it's crazy that testosterone is overlooked because that muscle mass really matters. And I've even heard from different influencers, like I think it's Peter Attia talks about the muscle group that women need to live longer is in their legs. The more muscle you have, I think as women, as you go through age or maintain or keep or build, the odds are you're going to live longer. So I think denying women testosterone is really sad. But also, on the other part of it, the flip side, we were talking yesterday to a provider here in Sioux Falls, and one of the tragedies that we don't ever bring up to people is intimacy really can be a problem, especially post and peri. So, talk to us a little bit about what you see in your practice with women and how testosterone helps them.
Absolutely. Well, kind of going back to your muscle comment, what I would always tell my patients, like in the hospital, what builds muscle builds bone. So we need those stimulus, and the hormones also play into that as well. You know, estrogen definitely plays a role in bone density, but testosterone does as well. So both of those are very important hormones that as they decline, we start to see those effects of that. So it's more than just the effects of aging, it's also the effects of menopause and perimenopause. When it comes to libido, testosterone, that's like the number one thing that it's used for, at least in my practice. And it makes such a huge difference in the woman's quality of life and her ability to feel like herself again. And I have some patients who, again, we've done all of the other things, you know, and we go down that road. I'm like, okay, or they come to me because their doctor will not give them testosterone. And they're just trying to find a provider who's willing to work with them and isn't afraid to approach that. And it's the fear around using testosterone with women I find really interesting. It's like, we're not giving them performance level, testosterone here. Like, we're not going to overdose them with this. We're practicing, consciously and making sure that we're following their labs and their symptoms and everything like that. But it has been that huge shift where everything else we were doing, we can improve, the symptoms of the vulvodynia and things like that. But when we are talking about the actual drive and desire, testosterone was really one of those things that has been able to make a huge difference for those women.
Well, and I think for so many years, it seems like, Jan and I have been doing this for over 30 years, and it seemed to be taboo when you would talk about, libido or sex drive for women and how you would want to increase that. But, it's a very important, intimacy is a very important part of a life, and especially a marriage and a relationship. And without it, you're just roommates. So, and, you've probably seen in your practice perimenopausal women or menopausal women, the divorce increases at those times of their lives. And that's part of the reason why.
Yeah, absolutely. Yeah. And then the women that come to me, some of them will be like, I have no desire and I don't care that I don't have desire, but I know that I should, so it's that kind of a thing. And it is taboo. And I do make an effort to talk about it with my patients because they feel kind of embarrassed by it. We're still in that generation of like, our parents didn't talk about it, so we think it's taboo, but it is important, like you said, for the relationship of the woman with her partner and even with herself. Like if she doesn't feel like this transition is already hard enough, you feel like you're losing your womanhood when you're no longer able to have a baby. Society kind of, this is a society norm that women going through their 40s and 50s and beyond aren't really women anymore. And that's not true. It's just absolutely not true. So if we're able to do something to help kind of reclaim that again and have that vitality come back and that zest for life in general, not just necessarily in the bedroom, but it's all over the place. And they've even shown women who are with lower sex drives or completely gone, they don't perform as well at work either, which is really interesting. It's a whole confidence thing and being able to own your power. And it doesn't matter if it's, at home or apparently in the boardroom.
Right. And well, I mean, we really shouldn't be that surprised when we think about what happens with men that get lower testosterone. They have, not only decreased libido, but they have decreased competitiveness, decreased drive, depression, things like that. I mean, women are going to have the same effects. So we shouldn't be surprised that when women have more testosterone, not only will their libido be better, their relationships better, but their performance at work should be better. We shouldn't be surprised when we think about what testosterone does.
That's so true. Yes. I think a lot of women just don't even think about it, though. They don't make that correlation.
Right. And I think, that's part of our job, and we failed as healthcare professionals in the overall field because we haven't educated women about that. And probably a lot of times what you hear, you'll see this in your practice, I'm sure, these women have been to multiple doctors and they say, oh, as you get older, this is just normal.
Mm-hmm. Mm-hmm. Yeah. There's just that general thing of, this is just what you need to accept. And thankfully, there are a lot of women out there, and there are a lot more doctors and, people like you two that are having that conversation and making sure that women know that just because it's common and happens to a lot of women doesn't mean that it's normal, and doesn't mean that you need to accept it as inevitable, that there's nothing we can do, because there's lots of things that we can actually do. So being able to come out and have that education with them and talk about it with other providers too, because, we talked about this at the M Factor. We don't get trained in this in school. Whether it's MD, DO, and DNP, none of us get trained in this. We have a brief little thing about menopause, and we talk a little bit about osteoporosis and the increase in heart disease, but most of it is, more focused on the reproductive years, which are also very important, but we need to also address this other transitionary period that is a huge part of a woman's life, and we're living a third or more of our life in menopause. So to be able to address that properly and treat that transition and make sure the woman continues to be healthy and happy and vibrant through that, I think is a vital part that we're really missing from the education.
Yeah, I will speak for my education, but I had a 1 hour, 50-minute lecture on hormones for women, and it was Premarin only. That's basically what we learned. And we didn't learn anything about men, but we didn't learn about nothing about testosterone for women, nothing about progesterone for women. We learned about medroxyprogesterone acetate for women. So yeah, it was a one hour course.
Yeah. Yeah. And that's grossly inadequate.
Yeah, for sure. I mean, we can go to a lecture for 3 days on just hormones and still just scratch the surface.
Yes. Yeah, absolutely. I've been studying it now for the past 3 years, and I'm like, wow, there's so much to know.
Yeah, right. The more you learn, the more you realize you don't know, right?
Yes, exactly.
So we talked about intimacy, but one of the things too that I think as women, we don't fully understand how important our pelvic floor is for us as we age. Our urinary tract and all that. So can you speak to that a little bit? Because I feel like that's a prevention that so many women aren't talked to about, that we could make some huge difference in their quality of life as they age.
Yes. Yeah, the increase of things like UTIs as we're going through that transition, the vulvodynia and things like that can happen for a lot of women. It's really tragic. I actually saw I think it was a TikTok reel, and this woman was like up to 70% of, women die from this or something, from the UTIs that can happen because of the change in the estrogen. So it makes it more friable. It makes it more prone to infection because the estrobolome is a thing, and it affects your balance down there as well as in your gut too. So it affects the entire body, but especially in that area. And the estrogen cream vaginally is so easy. It
Right.
should almost be over the counter. Yeah. And the fact that, I going back to my time in the hospital, I would have, recurrent customers, women who would continually come back in, who were in their 60s and 70s with these chronic UTIs and sepsis from this. And I asked that question. I was like, why is she not on estrogen? What are we doing? And the only thing I could do as a hospital is to send them back to their primary care. We don't prescribe hormones in the hospital because it's acute care. So it's a completely different system. But to see that, I was just like, wow, okay. And that's one of the things too that I always ask is, do you have any leakage issues? And a lot of women, it's common. So they think it's normal to have leakage. And that I have very close relationships with several pelvic floor physical therapists because it's so important. And any of them, I'm like, oh, you're having any kind of issues, we're sending you over to have an evaluation, because even just knowing how to control that area, we never were taught that. And a lot of us have too much tightness. They think they need to strengthen their floor and do more Kegels. That's could be the last thing you should be doing. It actually might be making things worse. So combining that therapy, the hormone therapy, and the evaluation with a pelvic floor therapist, I think is a vital part of their care.
And, you know, I say, back on the subject of estrogen vaginal cream, I think every postmenopausal woman should do an estrogen vaginal cream. Because if they don't have leakage or incontinence, if they don't have chronic UTIs, they're going to. Eventually, they're going to. So why not just put them on, you know, some estrogen vaginal cream twice a week for the rest of their life? And women will ask that. It's like, well, how long do I have to be on this? Well, you want to prevent all those symptoms, you'll be on the rest of your life. You're not going to magically start making estrogen again.
Yes. Yeah. That's a really good thing too, that comes up pretty frequently when I'm doing like my events and things like that. Women coming up to me and talking to me about this. How long can I be on the hormones? Or I heard you're only supposed to be on it for 2 years. I'm like, that's what we used to think, but that's not true. Like, as long as you're healthy and we're watching you and everything's going well, you can be on them indefinitely. There's no end date.
Well, and the answer I give to them, especially when they've had osteoporosis or osteopenia, is, so, okay, your doctor wants to take you off hormones. They only want you on the hormones for 5 years. These hormones have helped your bones, along with all these other things like vaginal dryness and urinary tract infections and all this. If your doctor was prescribing something for bone density, how long would he keep you on it? Forever. We don't stop Bosamax because it's 5 years. We keep them on it forever. So why don't we do that with hormones? And I get it. That's why we're talking about this. But you know, the WHI study just really, really threw a wrench into a lot of women's health.
Yes. Yeah, absolutely. And when you really look at the cohort that they use with older women who are already sick, there is some evidence that, you know, using estrogen when there is already underlying atherosclerotic disease could worsen that, just because it does make those vessels more pliable. We could be loosening some things. So then that first year could be a little bit more of an increased risk there, just because we're actually increasing the health of the vessels that might already be sick. So that is something to consider. But that's why I think we saw that increase in some risk factors there, because they were already older, they were already sick. And then we try and put them on a treatment that it's, well, we should have started it earlier. And that's the whole image behind this.
Yeah, start early. That's really the answer.
So we also now have generations of women like myself that started on synthetic estrogens in our 20s. And now we have teenagers. So there's a lot of young women out there that are struggling. You know, it's a hard topic, but what is your opinion about, I mean, in my opinion, the birth control pill has been used for everything under the sun for women. Even my friends that are, you know, post-menopause or even menopause, it's like, why is that hormone okay? Why is Premarin okay? But we deny women things like progesterone, testosterone, and real estradiol.
I think it's a familiarity thing, and we're definitely taught to just throw the birth control at it to control symptoms. It's a Band-Aid. And I have women that have been on it for so long, and they were put on it when they were younger for symptoms, not for birth control purposes. And now it's like, they're like, oh, I want to come off of this. I've read some things, and I think it's time for me. I've been on it for 20, 30 years. And I'm like, okay, let's do this. So we're going to have some effects of this. And The Fifth Vital Sign is actually a really great book that I refer a lot of women to read, because she talks about coming off of birth control and kind of what could happen through that process, so that they're aware of those effects. Yeah, and the women in perimenopause who are like, you know, late 40s, and their doctor's like, oh, let's put you on a birth control pill. And it's like, are you serious right now? Like, she's not trying to prevent pregnancy anymore. She wants to control her symptoms. And that's not the way to do it, just to throw something that's going to suppress everything and not actually address the underlying root cause. And that's the problem with the birth control pill. I think it's just been used to suppress symptoms without looking for root cause, because it's easy in a 15-minute visit to write a script and send send them on their way. And unfortunately, that's where women's hormone health is really lacking in the care in the standard Western model, which is why I've gone more to like a functional type of a thing.
Yeah. So I never thank you for one of the things that we love about doing our podcast, Nicole, is that we learn something all the time. I've never even heard of this book. So
Really?
yeah. Tell us a little bit about the book. Obviously, you recommend it.
Yes. There's another book recommendation too that I'll have for you along the lines of libido. So The Fifth Vital Sign, wonderful book. Lisa really lays out why our menstrual cycle is so important, and she goes into detail. So it might actually make some people uncomfortable because she talks about like the menstrual blood and what it's supposed to look like and what normal looks like and abnormal looks like. But I love that because if you don't know what normal actually is,
Right.
you can't tell what's abnormal.
Right.
So yeah, I would have women be like, well, I have like this clear drainage. I'm like, that's okay. That's normal. It's not like smelling or anything, like it's normal, but they don't know that. So a lot of women were never taught about our bodies like that. And this book is just brilliant. She lays it out. It's very easy to read, and it's made for like just normal lay people. It's not like a medical textbook, so you can actually understand what she's saying. So yeah, I highly recommend that one. The other one I would recommend too about libido is Come As You Are. What was her last name? No, I can't remember. But Come As You Are. She's a PhD and she teaches about sexuality. And again, lays it out very, very simply and talks about how complex libido is. And really helped a lot of my patients actually that were struggling with this. Is I'm like, I can put you on the hormone replacement. We can address all these underlying issues, but this is also a psychological thing. And this is a partner thing. So we need to be able to have those conversations about what is, what are your stops? What are your goes? What are your drives and how do those change as we age too? There we are. Yes.
I think that's a really great point. That's something we just discussed with a lady yesterday, a lady provider that's been in the field for a long time. And, there's so many different parts of the components of our sexuality and intimacy, and having the conversation, I think, really opens the door up to make it okay. And especially with our partners. I mean, that should be something that, we should be able to do. And as we go through different changes, that's super important. I think with peri and menopause, it becomes even more so because we are changing as women so fast and so radically.
Mm-hmm. Absolutely. Yeah, being able to have those conversations with your significant other, because I've seen some of the little TikToks too of the men who are talking about their wife who's going through perimenopause and how she's like a completely different person, but they're just trying to like hold on for dear life. So I think it helps both, the woman and her partner to have these resources that they can understand what's going on and then help each other too, so that he can be supportive or she can be supportive to her partner while this is happening to her body, because it makes you feel crazy. You feel like you're just completely out of control. Your emotions are all over the place. Your sleep sucks. You've got hot flashes or you don't, but it just makes you feel like you're just not yourself. And it can happen pretty suddenly where you were fine and then like I'll have women come to me and they're like, 2 months ago, I just started having all of this happen to me and I'm 43. And I'm like, yep, here we go.
Yeah, right. The first question I always ask is, okay, so have your cycles been changing? Yeah, they've been irregular for the last 3 or 4 months. Well, here we go.
Yeah.
Well, finding somebody to help you is really important too, because I've found in our practice that if women can sleep, and I'll speak for myself, once my sleep cycle started becoming more normalized, I'm not waking up as much hot, sweaty, and getting a good night's sleep, my perspective of being able to work with your family, your job, your children, your problems, it became it came back, the universe came back, right? Where before it was like, I don't even want to address this. So talk a little bit about how you help women with their sleep cycles, because I think that's a big one. At least for me, it was.
Oh, it is absolutely key. If I have a woman who she has like, oh, I've got this and this and this and then, but I'm not sleeping. And I'm like, well, then that's the number one thing we have to work on
Yep.
because it doesn't matter anything else I do. If you're not sleeping, it's not going to work. Yeah. So one of the first things, you know, that we see in perimenopause is that progesterone starts to drop, and that has a direct effect on sleep. So that's one of the things we start to look at. Okay, maybe we can try that. We also look at her routine. A lot of women don't realize that going through perimenopause is like your second puberty. Like we're going through another transitionary time, and we are literally being rewired on a cellular level, including in our brain. When we were younger in puberty, we probably didn't because we had, you know, school and extracurricular activities and stuff, but we were actually supposed to be getting more sleep, not less. And same thing happens through perimenopause. We should be getting more sleep. And I have a lot of women who are like, well, I've been sleeping 6 hours, you know, 5 to 6 hours my entire life, and I've been fine, but now it's not enough. I'm like, yeah, I know.
Right.
So we need to have more time. We need to have a better wind down routine because chronic stress will absolutely affect us, and our adrenals are not able to compensate as well as they used to. So they'll notice their ability to cope with stress is just not there anymore, like it used to be. You just need to acknowledge that and like take that extra downtime. It's okay. Like, again, we are being rewired as our hormones are changing. So allow that to happen and be okay with taking more time for yourself, which is really hard for women. I have a lot of women that's one of the number one things we work on too, is your self-care has to come first. You cannot pour from an empty cup.
Right.
And it's so hard. It's so hard because we're caregivers. We're, you know, we take care of the home and everything, and the men do too. And, you know, the men are quieter about it, but they're also suffering through this. But our fluctuations in our hormones seem to be more extreme. And so it kind of definitely takes more of a center stage than theirs. But yeah, sleep is definitely has to be the number one thing that is addressed. Another thing too is sleep apnea really increases after 40. And that's one of the things that's starting to come out in the research and hopefully will be included with the guidelines here soon, is that we should actually be doing a sleep study at baseline for women over 40 and then monitoring that, because even if we got our typical symptoms, you wake up and you still feel tired even after a full night's sleep, you wake up because you can't breathe, you have to sleep, you know, elevated, which could be other issues going on there too. And snoring, of course, is another one of those symptoms that we can have. But actually getting that sleep study done can be really insightful to see if there is actually something underlying there. So even if she is trying to get her 8 to 9 hours of sleep, she's still not rested, that could be something else that is underlying that.
For sure. And, you know, sleep trumps it all. I mean, that's just, we talk about all the time on our podcast with not just with hormones, but health in general. I mean, if you're not sleeping, you're just not going to be healthy. Those are facts. So, Nicole, as we wind this podcast up, tell us what you have a passion for.
Oh, like outside of work?
Anything. What's the first thing that comes to mind?
Well, this time of year, it's all about the garden. So I've been harvesting and processing a lot of gardening produce and everything. And then I'm going to be doing my, oh, look, there I am. Yeah. Talking about sleep.
Yeah.
And then I'm also going to be, I'm started my prep into a bodybuilding competition in October. So that's something that I'm looking forward to. And I'm also a perimenopausal woman. So this is something that I'm also very passionate about. And I believe that I deserve to thrive through this period and not, you know, because I feel like I finally came into my own, and I love my 40s. Like I would not trade it. I feel so much more like myself and unapologetic. And it's kind of fun to like, I don't care what people think anymore. And I used to care so much. And it's just so nice to come into this, you know, this phase of your life. And I've also seen studies where women in their 60s and 65 and older actually are happier in their life than they've ever been. And I think that's part of it. I just don't care anymore. But we should also be able to be healthy and happy and get the care that we deserve. So that is why I went into this practice, because I couldn't even get that care, and I'm a provider. And I thought, okay, well, definitely we need this.
Right.
Well, I'm going to speak for us, but you know, we're in our 50s and we are in the best health and love and life more than we ever have. So, you know, if you do find somebody that can optimize your hormones and just help you with your health journey, there's no reason you shouldn't be, in optimal health in your 40s, 50s, 60s. I mean, seriously, even 70s. We have patients that are in their 70s and thriving. And
80s too.
80s too.
We have a lady that just knocks it out of the park. I
Yeah.
mean, she's amazing. So I want to be her.
Yeah.
I want to be that person that has more energy than the rest of the people.
Absolutely. Yes.
So Nicole, tell us about your website and how to get a hold of you if anybody has any questions.
Yeah, so you can find me just about on any social media channel, Anti-Gravity Wellness, and then our website, antigravitywellness.com. I have all of my services are on there. And it's basically like, for women who are interested, you book a brief initial consult call. We talk on the phone for 20 minutes to see what's been going on and how I can help, whether that is giving you recommendations to take back to your primary care doctor or helping to take over that side of the care. I don't do primary care. I do only hormones. I want to specialize in that and stay in my lane. So that's what I do. Then we have the blog post is very active. Posting there at least once a week, usually more than that. So lots of topics in there. And then, of course, on my social media channels, we are posting every day. I've got videos and we go live and we have posts and everything. So if you want to learn more about perimenopause, that is where you should go.
I love it. Thank you so much, Nicole, for being on our podcast today. You've helped us realize our goal, which is to educate and empower individuals to take charge of their own health. So thank you so much.
Wonderful. Thank you so much for having me, you guys.
And thank you, listeners and viewers, for tuning in to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regularly scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you.